YouTubers to my channel of an everyday life of an Aspie. If you're following me right now, I'm AspieAnswersAll. I'm all about creating mental health and awareness versus sharing my life stories with suspicious syndrome and the like. I also talk about some mental health disorders versus also just taking you all on a journey with tips and advice on how to manage all of your mental health disorders or just health disorders in general of whatever it may be, and hopefully along the way just to give you not just the tips and advice, but just words of encouragement, by pills of wisdom, encouragement, knowledge and know-how based on my experiences through what I can do. I know some of these tips and advice may not be, of value to you if you're watching, but just be in mind and consider it to the ones that are watching and maybe are seeking, answers or just seeking help one way or another of some form of support, so that we can be a supporting community and not put people down. Just to be in mind also that before I begin this, I'm not an medical doctor. I'm just a normal Joe Blogs going through my everyday personal struggles on my own, sharing you guys my life experiences as we go, and obviously in this point of time that hopefully based on my knowledge, experience and know-how through these struggles, that hopefully some of this will be beneficial to you. So also, just to let you know also now, I'm into the next part of this series of the Let's Talk, and this one's all about the men's health especially. I feel close to my heart to share these because as this says that basically sometimes men's health doesn't obviously gets talked about much, or just not get much awareness, or what have you. So I'm going to be one of many that probably will be bringing out some topics on those, and hopefully some of it will be educational and motivational to you. So if you see any early signs and symptoms based on your partner's classical journey of whatever they may be suffering from, or what have you, or going through, shall we say, be sure to seek medical help or seeking medical opinion and advice. Some of the treatments that I may give to you may be of help to you as well as to whoever may be watching. Hopefully in all honesty that it will be of value to you and that can support one another. So let's begin this. This is all about the diabetes, and then let's begin this. Just remember that I'm talking in statistics of New Zealand because I'm based in New Zealand. So diabetes, obviously every day 50 New Zealanders are diagnosed with diabetes, right? So the question is obviously, what is diabetes? Okay, as you know, insulin is a chemical that is, or chemical hormone that is produced by the pancreas that helps our body process in everyday sugars. This will ensure that there isn't too much glucose, or shall we say the sugars, in the bloodstream. Diabetes is a condition where the body doesn't make enough insulin, or our cells become resistant to insulin. As a result, that will increase the high levels of glucose in the blood. However, there are two types of diabetes that directly affect men, and they are type 1 diabetes, which is usually diagnosed in childhood and occurs when your body stops producing insulin altogether. People with type 1 diabetes need to have regular insulin injections to stay alive or to live. Type 2 diabetes, however, is when your body doesn't produce enough insulin or your cells become resistant. Type 2 diabetes is usually the result of poor diet choices and is strongly linked with obesity, however, which is a sad fact, but hey. 90% of all cases of type 2 of diabetes are type 2, and 50% of people with diabetes die from heart disease. What are the signs and symptoms? Classic signs and symptoms for people with type 2 diabetes for years without realizing it. Not everyone has the symptoms, but it may include some of the symptoms of the following. Number 1, impotence, which over half of men with diabetes will have impotence as a result. Number 2, poor eyesight or blurred vision. Number 3, feeling thirsty really often. Number 4, having to pee often. Number 5, frequently getting skin or urinary infections, and infections that may take longer to heal. And number 6, I think I'm up to, is mood swings. Who gets this type of health disorder? Historically, type 2 diabetes was most prevalent in men in the ages of the 45 plus group, but is becoming more and more common for men in all age groups, including teenagers and children. Chances of developing diabetes increase if you do or are, however, overweight, not very active, or eat very high, a lot of food that are high in fat and sugars. Diabetes can run in the family. It can be hereditary. Obviously, they reckon that on the health board you may be more at risk if you have a family member with diabetes, or if you're in the Pacifica group or South Asian or even Māori group. Chances of developing diabetes increase as you get older. 1 in 5 men over 65 will have diabetes. Getting tested. If you have symptoms of diabetes or are overweight, your doctor or nurse might send you to a lab to get a blood test called an HbA1c test. This test can measure the average levels of glucose in your blood from the past 3 months. If your blood glucose levels are too high, this will mean you're most likely to be diagnosed with diabetes. If your glucose levels are high but not high enough to be diagnosed with diabetes, you might be diagnosed with pre-diabetes. However, pre-diabetes is actually what it sounds like. It means you almost have diabetes and you need to make some of the lifestyle changes and choices to live healthier, to reduce your blood glucose levels. Review the diet you're on, try to eat healthier, cut back on alcohol and get more exercise. Your doctor will organise a test to be repeated in 3 to 6 months' time. Treatment options. It's really worth trying to avoid getting diabetes in the first place, because once you have it, unfortunately you're stuck with it for life sometimes. But there's heaps you can do to manage your condition that will help regulate your blood sugars and keep you as healthy as possible. Eating better, losing weight, cutting back your drinking and getting more exercise are the most essential. If you're diagnosed with diabetes or pre-diabetes and you choose to ignore it, you're in for a troubled life. Unmanaged diabetes can lead to kidney failure, blindness, heart disease, ulcers and amputations of arms or legs. So it's totally worth putting in the efforts to make these lifestyle changes and choices for yourself. Well, basically, before I end this, I'm going to just let you know that if you want further information based on this topic of diabetes especially, I'll put in basically some of the links here in New Zealand that may be of help of some organisations to get more information based on what I'm sharing with you all. Feel free to comment below basically of anything that you want to put as a form of encouragement for others as well, just to let them know that they're not alone and that they can do it regardless what it may be. Feel free to follow me on Twitter, Facebook, AspieAnswersAll. Feel free to subscribe to my channel if you haven't done so. Feel free to just, give me the like for thumbs up for support. Feel free to also just, share these videos around to family and friends, because like I said, some of these topics I'm clearly addressing right now need to be addressed, obviously, especially to the men sort of thing, because this is really important for me to actually bring it out there, even if I am just one of the many that are just doing it, one of the few that will be sharing this topic. Feel free to also just, share these videos around to family and friends, just as an educational, motivational tool, or whatever it may be for your valid reasons. So thanks for your support, thanks for watching, do what you love what you do. Until next time, Aspie signing out.